Okay, so let's start with the introduction. We'll go through some of the aims and some questions that we're looking to try and answer initially. So, first of all, why do we test blood? We test blood for a number of reasons, and there's quite a lot of information that we can gather from blood tests. There's lots of different profiles and panels that give us a bit of a clue about what's going on in our bodies, whether that's from the bone marrow, from the production of cells point of view, from the kidneys, the way the kidneys and the liver are functioning, and so on and so forth. We test the blood to be able to give an insight to how our daily life and our health activities are contributing to the health of those particular areas, and then maybe we can then create a picture of how it fits into the grand scheme of healthiness from a systemic point of view. Why is monitoring useful? So monitoring in this respect is why we look for trends. We take the blood test at 1 year, and then maybe a year later we'll do it again, and then again and again and again. By doing that, you're continually using outcome measures to make sure that you're basing your health decisions on good quality information. It might be that you would get your blood tested at a general practitioner's office, and a lot of the time these blood results come back as completely normal. However, there are still insights that can be gained from some of this normality. If your, for instance, B12 is running lower every year on year, then the trend would suggest that actually the diet that you're employing is not maintaining adequate levels of B12, and at some point you will become deficient. We can also have a look and see what your glycemic load is doing, and maybe say, if you continue at this rate, then there'll be some concerns that you could be developing diabetes or maybe impaired glucose tolerance. Monitoring helps us keep an eye on how things are going, and it gives us an idea of how our decisions and how our lifestyle decisions are making a difference into our health over the long term. It also allows us to be proactive, so that when things are actually starting to come up, we can spot them straight away and we can make changes as needed. So the aims of this series mainly were already highlighted in the introduction, but we'll just go through them quickly again. I just want to give an overview of what the blood tests that we do on a Nuvictus panel are, first and foremost, what sort of things that we're looking at initially, and give you an idea as to why we test these specific panels and these specific profiles. Future series will start to then delve a little bit deeper into that, but this is just a really good starting point to hopefully give you an idea of why we're testing what we're testing, and be in a position where you're informed, understanding what these tests actually do, what they're looking for, and give you an idea of how to be more engaged in this data and in these results, hopefully making better decisions for the future.